Hi there. My name's Bing Jones, and I'm a retired doctor and an artist. You can see all these pictures. I'm from Sheffield Community Contact Tracers, and I'm going to talk to you a little bit today about why NHS Test and Trace has problems and what we in Sheffield plan to do about it. Okay, so let's start with NHS Test and Trace. The essence is that it only starts with testing, and a lot of people are just not going to go and get tested. Some of them are afraid, they're a bit wary of the whole process. There are language difficulties, cultural difficulties. You need a car to get to one of the testing centres. There are lots of reasons. The second problem with test and trace is that around 30% of negative tests are actually positive. So they're false negatives. The test and trace system only contacts about 75% of people. So a quarter of the people who do get tested with a positive test don't get tested. And then another 10% of those people don't get their contacts sorted out. And lastly, the last problem is that there's no real audit. There's nobody checking to see or supporting the contacts or checking to see if they are going to stay self-isolated. So there are loads and loads of problems about test and trace, and it's not unlikely that only around a quarter of the contacts of people who need to be contacted are going to get contacted. So that's the first problem. It's dependent on the test. The second problem is it's slow. It aims to have a 24-hour turnaround for the tests before the results come through, but many people are saying it's very much longer than that. Again, there's no audit, there's no checking, there are no reliable figures. So firstly, it's basically flawed. Secondly, it's very, very slow. And thirdly, although nobody really can tell, there are almost certainly not enough tests. So testing is not available to all the people that it should be available to. So that's a really big problem. So that, as I say, it's not unlikely that only around 20 or 30% of people of the contacts that should be isolated will be isolated. And it's not unlikely that many people, many of these contacts will only be talked to and told to isolate 3 or 4 days later than should be the case. So what are we going to do about it? Well, here in Sheffield, we've already done a pilot scheme looking at people. We found from just 10 cases, 60 contacts, and we found a lot of information about those. So we've got a lot of experience. And we've dealt for quite a long time just dealing with symptoms. So if you get somebody who is in need of a test and you say, yeah, go on, join Test and Trace, you must get a test. But in the meantime, let's jump in there and see what your symptoms are. And there are characteristic symptoms with COVID-19, including a new cough, fever, and loss of taste and smell. And then there are other things which include shortness of breath and extreme and recent fatigue. So if you get all those symptoms together, it's quite likely that you can contact people very early, and then if they do get a negative test, you can then release their contacts. So the important thing is that we need to get over to all the people that we're talking to that the test and trace is important. They must do that. We're not a replacement, we're an addition, okay? So they must get tested and traced, and they must follow all the government advice. And the next thing that we really need to get over is that we are a study. Our first pilot was small, but got an enormous amount of national coverage, and I think that we could do similarly here. If we could find out, firstly, that we can find people who would not otherwise have a test. Secondly, can we work this through social media? Thirdly, can we isolate contacts early? Fourthly, can we actually say, we have found X number of contacts and we've isolated them 3 or 4 days early, then that's a really, really big plus. And this also will lead us on to the next phase of our study, which is to go out there and find people in hard to reach groups, people who are socially isolated, may have literary or sort of reading or cultural difficulties, and we can go out and find those people. It is really likely that COVID-19 is going to stay with us for a long time. It is really important that contact tracing works. We really need to get above 60 or even 80% of the possible contacts to make it work well. And at the moment, our national system is way off that. So let's have a go in Sheffield and see if we can really crack this and find something better. We may then be able to add to the national service. And we can certainly, if we make this work at all, get quite a lot of publicity and help people. Thank you very much for listening. Bye-bye.